San Diego County means fitness, lean, healthy people everywhere. We eat whole grains, fish, fruits and vegetables, low-fat dairy, and we don't overdo the overeating, right? Where have you been? Truth is, we're just as overweight and out of shape as everybody else. Pear is more than just a fruit. For many of us, it's our physique. We are what we eat, and for a lot of people, what we eat stinks. On average, we eat far more sugar, more fat, and more salt than we did just 30 years ago. We don't get enough exercise, and that includes kids, who for the first time ever may now have a shorter life expectancy than their parents. So what do we do about it? That's where Live Well San Diego comes in.
Live Well San Diego came about as a result of the Board of Supervisors looking to make improvements in the health and well-being of all San Diegans in our county. And in July of 2010, the board approved the first phase of Live Well San Diego, which is building better health.
Taking on the responsibility of a 10-year plan to improve the health of your region is a pretty lofty goal. And it requires a stable government, one that whose finances are sound, and one who has an understanding of really what their mission is and how something of this magnitude fits into that mission.
And it begins with these three numbers, 3, 4, and 50. 3 refers to big problem behaviors: poor nutrition, lack of physical activity, and tobacco and substance abuse. These 3 behaviors lead to 4 big diseases: cancer, heart disease and stroke, type 2 diabetes, and respiratory problems like asthma. These diseases result in more than 50% of all deaths in San Diego County. Take out the obvious human factor and look at just the numbers. Every year, these 4 diseases cost us, as Americans, $877 billion. That's more than any Wall Street bailout, bigger than all the money lent to the auto industry.
These costs have profound implication to our economy. In year 2007, our agency estimated the cost of these chronic conditions, it was $4 billion, almost equivalent of the size of our county budget.
So we know there are major problems. There are solutions. The challenge is to get the solutions to those who have the problems. Building a better health delivery system is the first pillar of Live Well San Diego. When you think health system, you usually think of a doctor, hospital, maybe a medical office or community clinic, but it's much bigger than that.
One of the great things the county has done is to have a concurrent application so that a person does not have to go from program to program. They fill out one application and they're assessed for which program fits their needs best.
Because we know those first 5 years really form the success of a child's life, it's critical that we can provide this integrated services, that we can partner, and that we can provide all those resources and share the resources that are available in the community with our entire San Diego region.
So good health doesn't come from working in silos. I mean, the County of San Diego doesn't do this all by itself. We have a lot of public and private partners. And the key is to make sure we're all working together, that we're all on the same page, delivering care and information to the most vulnerable populations while still maintaining high quality and being cost effective. A good example is 211 San Diego, a one-stop shop. Here, these representatives can help you with questions about everything from Medi-Cal to mental health services. 724-365.
When people call 211, they may be calling for a housing assistance issue or employment-related issue. And what's nice is, at 211, we're able to direct them to all the county programs, also determine if they might be likely eligible, where's the closest location for them to apply. So whether it's CalFresh or whether it's Medi-Cal or housing, all that put together really builds a Live Well San Diego.
Phone calls get referred to social, health, and behavioral services. Those 211 referrals are credited with getting more people applying for CalFresh, the state's food stamp program.
We've seen double-digit increases in the number of recipients since we started, and we have well over 200,000 recipients receiving CalFresh nutrition assistance benefits.
The old saying, "It takes a village to raise a child," can also be applied to medicine. Healthcare is more than just one patient and one doctor. We partner with clinics on a model where the patient is center stage and providers work together to bring care to the patient.
Those kind of folks that are really struggling and don't have easy access to primary care, or behavioral health services, that's what we're here for. And that's why we partner with San Diego to really provide that safety net for those populations. And I can honestly say that of all the counties that we serve, San Diego County is ahead of the curve and really forward thinking in this integration of primary care, behavioral health, and physical health. They're doing a fantastic job.
Clinics have psychiatrists to work with primary care doctors to address the whole health of a person. Case managers to coach and support patients, and having it all coordinated using new technology to avoid costly duplication of services and, more importantly, improving lives.
Well, these technologies will really help improve information sharing amongst providers and for the patient themselves, so they know their health status, so their providers know their health status. That means if I have better information as an emergency physician about a patient, I'll be better able to take care of them and provide them better care.
There's only so much a government can do when it comes to getting people to eat right and to exercise. I mean, after all, people are responsible for their own health. What a government can do, though, is encourage people to do the right thing by getting the word out about things like healthy eating, exercise, and living their lives free of tobacco and drugs. We team up public health nurses with mobile libraries. That gets health care and information out in the community, reaching those vulnerable populations.
One of the good things about our Building Better Health initiative is that it's simple. It's about eating better, taking better care of yourself, exercising, and really coming to understand that the healthy choice is the better choice.
Library branches also host hundreds of health and fitness programs every month.
The 33 branches of our county library system are a great resource for getting up and getting fit and getting out.
Not just libraries, county parks and recreation, a natural fit for fitness. Things like hiking trails in Lakeside and Valley Center, a new preserve in Ramona, perfect for riding, expansion of Sweetwater Regional Park, a new arena soccer facility in Ramona. The list goes on, all designed to get you out and moving.
Parks and Recreation has an extensive trail system, and we have fitness equipment in 3 of our parks. We also have hundreds of educational and health programs, one of which is our award-winning outdoor adventure program.
But not just parks. The urban environment is where we live, and it too is changing to encourage people to be more active.
With Public Works and its Safe Routes to School program, we're working on building sidewalks and infrastructure where it makes it easier for neighbors and kids to bike and walk, where the communities can really use the resources to improve their healthy lifestyles.
Then there's Healthy Works, a way of bringing residents, business, and community leaders together for things like community gardens, school physical activity, and nutrition programs.
Healthy Works focuses on healthy nutrition, healthy places, which is a buzzword for physical activity, and healthy schools.
Schools in San Diego have a breakfast in the classroom program. Kids get a free healthy breakfast every day. Attendance is up, and there are fewer visits to the school nurse's office.
The Breakfast in the Classroom program is an amazing opportunity for children to have breakfast together in their classroom, but to also ensure that children have the opportunity to have breakfast each morning. Prior to the program, only 27% of the children were having breakfast before school. Now an average of 92% of children are having breakfast.
Then there's lunch. The Farm to School Lunch Program partners San Diego Unified and local farmers, changing the way food gets to school kids.
It's our job to help set those healthy habits with our students. The sooner we can do that with the better food and healthy foods that we can bring in, then we hope to have created a lifelong healthy eater.
This is the groundbreaking for the Mount Hope Community Garden.
Communities too are getting in on the act. We're making it easier to start up community gardens.
We don't have a lot of markets or grocery stores in the neighborhood, and the ones that we do have, the fruit is not the best quality. So we're hoping that we're growing fresh fruits and vegetables. And when I say we, the residents here, it's a plotted garden, can grow those fruits and vegetables and make them available not only to the families, but to the merchants in the area to sell.
Like community gardens, farmers markets are a great way of getting fresh fruits and vegetables into communities. The Fresh Fund program is opening up these markets to families on CalFresh and other assistance programs.
It provides the opportunity for individuals to obtain fresh fruits and vegetables and other produce that is grown by local growers here in San Diego.
In all, it's not about telling people what to do to be healthy. It's about encouraging good, healthy choices and working with community partners to make sure those healthy choices are an easy choice to make wherever they go.
As we improve the health of our community and improve the health of the residents in our community, that means a healthier population from which local employers can recruit. The healthier employees mean more productive employees, and more productive employees mean a healthier bottom line for local employers and for the county.
Working to make policy changes is the third pillar of Live Well San Diego. See, you can do all the encouraging you want, but if the current rules don't allow you to set up that farmer's market or to have that breakfast in the classroom, it really doesn't do much good.
It's really looking at how we influence health policy in everything we do, not only within the county, but with our community partners and other governmental jurisdictions.
We have something called a Resident Leadership Academy. This gives people in the community buy-in, getting them involved in the planning process to make positive change in their community. Residents learn how to assess their neighborhood, figure out what's needed, how to prioritize those needs, and get it done. In short, they learn how to make a difference.
I've never seen people come together like this. One thing I have realized is that the people in communities are thirsty for this type of opportunity. Normally, when you walk down the street and you want to talk about issues, there's not really a forum that takes place. What we've done successfully is bring really diverse groups together. They know in their heart that they're a community steward. They just want to know how to make a change.
The city of La Mesa now has community wellness in its strategic plan, emphasizing things like walking, biking, and healthy eating.
It totally makes sense to make sure that all of our policies support the built environment being accessible for people in our community. It will create long-term policies and a long-term commitment to having our community be the healthiest that it can be.
The County Office of Housing and Community Development makes sure food assistance and nutrition information is given to every person receiving Section 8 housing assistance.
Studies show that stable housing provides the foundation to allow for healthier choices and access to medical care.
The county launched a major public awareness campaign called It's Up to Us, designed to erase the stigma of mental illness, encouraging clients and family members to talk more openly about mental illness, recognize the symptoms, and get help.
We have had live interviews with clients who have been homeless for 20, 30 years, off and on, have suffered from mental illness and substance abuse, and now they're members of our community living independently.
The county is always looking for ways to share ideas and get the word out about building better health. We engage community groups, meeting, talking, getting to know the concerns of the area. What may be a minor concern in one part of the county may be a major concern in another.
In the South Bay, we mapped the areas where there was high crime, and they also corresponded. It was close association with childhood obesity, and we started working with local residents and our hospitals and clinics and communities to not only clean up the parks, use the parks, but then also the city of Chula Vista become an active partner for us to engage residents in keeping their parks safe.
In the end, it's going to be what's happening in the neighborhood, what's happening where we live. Where we live, work, and play has a big impact on our health. And for us, we want to go out and really make it easier for people to make healthy choices, to make it fun, to make it the right thing to do, and to really get the momentum going and not leave anybody behind.
It's all about getting out there, listening to each other, and working to make positive change. Improving the culture from within. What does that mean? Well, it's one of those that starts with the person in the mirror kinds of things. You see, we can't go around promoting healthy lifestyles to 3 million people in the county if we don't lead by example. We work to improve and encourage healthy living among employees. We do things internally to support good health.
This is really about worksite wellness. It's how do we improve the well-being of our own employees, walking the talk as we're asking those of others to improve their health, doing the same for ourselves.
The county has roughly 15,000 employees. That's 15,000 health ambassadors who must practice what they preach if there's any chance for success among the public.
The mission of the Employee Wellness Program is to make healthy choices, reduce risk factors, and maintain a productive, active, accountable, and engaged workforce.
The county's Latino and Filipino employees associations are also helping get the word out about building better health.
The employee resource groups are vital resources because they have certain expertise, knowledge, and leadership that helps the county connect to the underserved communities that we're trying to reach. Because of their understanding of some of the nuances associated with these cultural groups, because they understand creative ways of conducting outreach to these groups, where perhaps traditional outreach efforts are not as effective.
Call it a win-win. County employees in the Philip Rivers Walk and Fun Run, getting exercise for themselves and benefiting foster care organizations.
Our partnership with the Rivers of Hope Foundation is a great example of a public-private partnership that has allowed us to really engage our agency employees as well as our foster youth in really exposing them to a healthier lifestyle and an opportunity to really have fun and exercise.
So, is all this easy? No. Is it the right thing to do? Yes. This is long-term strategic thinking, 10 years and beyond. This is looking at the big picture, a picture that can lead to a brighter, healthier future.